Did you know that breast milk is the ideal food for your baby? It provides all essential nutrients along with anti-infective agents such as antibodies and white cells to enhance your baby's immunity. Here are some quick tips for breastfeeding.
It is best to breastfeed your baby as soon as possible after your baby is born, as it helps to establish your milk supply. Breastfeed your baby regularly on your baby's demand. Allow your baby to feed as long as your baby wants on the first breast before offering the second breast. The average breastfeeding mother typically breastfeeds 8 to 10 times in 24 hours.
Look out for early hunger cues, typically when baby opens his or her mouth and can be seen wanting to latch onto the breast. Apply the correct breastfeeding technique can help ensure your baby latches on well and receive adequate intake of breast milk. With correct positioning, breastfeeding should not be painful. Monitor your baby's satisfaction after a feed. Observe your baby's urine and stools to check he or she is having adequate intake of breast milk. After the first week of life, breastfed babies usually have bowel movements after every feed. At 6 to 8 weeks, some babies may have less frequent stool output, about once every 7 to 10 days. As long as baby is gaining weight well, this is normal as breast milk is well absorbed. New mothers may face common problems such as sore nipple, latching difficulties, insufficient milk supply, and engorgement. Seek help early or speak to your lactation consultant.